Hi guys, so the next two videos we'll be talking about reflexes. This first one will be on cranial reflexes, and I'll provide a link at the bottom for you to watch an example of a pupillary and consensual light reflex. The next video will focus on spinal reflexes, and I'll make sure to give some demonstrations there too. Alright, let's get started. Alright, getting into cranial reflexes. A cranial reflex is a reflex that is integrated at the level of the brain using cranial nerves. And this is different than the spinal reflexes that we'll get into in the second video. Cranial reflexes are important because they're used to test these tests are used to assess the integrity of the cranial nerves involved. So we're going to get into a couple of examples. First off, we have the corneal reflex, and this occurs due to stimulation of the cornea, which causes the afferent neuron, cranial nerve number 5, to send signals to cranial nerve number 7, which ultimately causes contraction of the orbicularis oculi muscles. And this is important because if something gets in your eye or stimulates your cornea, you want to blink it out, right? Next one we have is the gag reflex, and this occurs from stimulation of the soft palate, and this affects cranial nerve number 9, which sends signals to cranial nerve number 10 to ultimately contract the pharynx, and this gives that hoarse kind of cough to the sound to the gag. Next up we have the pupillary light reflex. This occurs from stimulation of light in one eye. This causes cranial nerve number 2 to be the afferent neuron, which sends signals to cranial nerve number 3 to cause pupillary constriction of the same eye. So what this means is if you shine a light in your left eye, your left pupil will contract. This is different, but very similar to the consensual light reflex. So let's say you still have the light shown in your left eye. It affects your left cranial nerve number 2, but that causes the efferent nerve, the cranial nerve number 3 on your right eye to also tell your pupil to constrict. So you have constriction happening on both pupils from light stimulation on one side. It's just one is named pupillary light reflex and the other is consensual because they both contract. Okay, the last reflex we're going to talk about for cranial reflexes is the salivary reflex, and this occurs when you are thinking about food or you have a stimulation of your tongue. So this occurs through cranial nerve number 7, sending signals to cranial nerve number 9, which ultimately secretes saliva, or leads to the secretion of saliva. So go ahead and click the link below to watch that video on pupillary and consensual light reflex. And we'll talk about more reflexes in the next video.